Hello, I'm Robert, and I'm trying to explain contact tracing because this is the key to suppressing and stopping the COVID-19 outbreak. If we're going to stop this in the near future, we've got to do the contact tracing. And the WHO say that over and over again. Many countries, sadly, are doing the very visible thing of physical distancing, very dramatic, and telling people to stay at home and keep 2 meters apart when they're out in the streets. And they are not doing the rest of it, which was the key to the success in China. So if we go back and look at the China case, and I'll explain that diagram in a minute. Oh yes, I'll put that's in here. If I go down a bit, so this is how China had the Wuhan city shut down, and then that was a very dramatic, obvious thing. But this, according to WHO and other people who looked at it, this would not have stopped it if they just done the physical distancing. It would have kept on going up and up and up. Just the physical distancing was not enough. What they did as well was the isolation of contacts. They did a lot of case finding. They found the people with it. They then isolated the people who had it, and then they also quarantined all their contacts. And that's how they managed to bring it down so quickly. This is the symptoms onset. This is when the diagnosis is. So you notice the diagnosis rather later. So if they'd just done the physical lockdown, it would have kept on going up. The lockdown, though it was very, very dramatic and very obvious, was not the thing that gave them their success. And that is absolutely certain according to the joint WHO-China report. And they looked all the way around, they looked at what the Chinese did, and they said that is the key, that's what they did. And South Korea got that message, Singapore got that message, Italy and Spain got that message, and that is why they have managed to reduce their cases. We've got Italy having its deaths per day reducing. The United Kingdom is not doing this yet. Indeed, it is not even isolating the mild cases. This is South Korea, it did the same thing. Tenfold reduction in a fortnight. It goes down roughly as fast as it goes up. So this, in a way, it's very, very sad what's happening in the United Kingdom. The plus side of all this is that it's very, very promising. If we do go around, we can reduce very quickly. So if you look, for instance, at the United Kingdom, and let's just do it, there we are, I just need to type U now and it comes up because I go visit it very quickly. Then if we go and look there, then if we go back to the 11th when we started the lockdown, then 11th of March, and then if we go and look at the confirmed cases, which is the last row on the page now. So when I go down to the 11th, there was 460 confirmed cases. So now we are on the 5th of April, and we have about 100 times as many confirmed cases now as we had back then. And these are the hospitalized ones, and probably 5 times as many of those if you include all the mild cases. So we've increased 500-fold since the 11th of March. And I don't see much sign that this is actually decreasing, being flattened. You've got to take these with a pinch of salt because you've got the deaths. We've got the deaths increasing, and then looks like it's a reduction in deaths. But what you've got to bear in mind is that these deaths are underreported. I'm not sure if that's accurate now. Anyway, these deaths are underreported because they are not counting mild cases that die. So some people die at home before they can get to hospital, and some people, if they're very old, then they might decide they don't want to go on a ventilator. So again, they would die in the care home. And these people are not being counted in the deaths because they don't get tested. Even if they die at home, if they only had mild COVID-19, the UK doesn't test them. Now, they said that in the news today. So the situation is looking really rather sad. But the good news is that we can go back just as quickly as we went up if we use the same method that is proven to work with those other ones which are bring it down. If we use these methods proven to work, it's a winning strategy with South Korea and China. This same method will be able to bring us all the way back from that 40,000 all the way back to the 400 we had when they moved to the delay phase. And well, it's actually more than that. The possible 5 times that, so 200,000 or whatever, could bring it all the way back down to 400 at the same speed it went up. Now, it would actually go up, if we look at the Wuhan, it will actually go up a bit further because there's a delay. We've actually got more than that, 200,000 probably, because you get the delay of the diagnosis. So we are at the diagnosis there, and it will keep increasing quite a lot. So we could even have, 500,000 or more, maybe even 1 million infected. But even then, so then you could have an extra 2 weeks to go up to that number, another 2 weeks to come back down again from it. So if we add all that up together, then sometime in mid-May, if we were to start this right today, we would get back down to our 400. And then sometime in perhaps June or so, we would be back down to 0 cases. So we are definitely making things much worse for us. I think there's no doubt about it, because we are not copying the contact tracing. So what is this magical contact tracing that makes such a difference? And that's my main thing I want to explain. And this is what we absolutely have to do. And in essence, I was explaining here that the British Medical Journal is calling on the government to do this. So what is this contact tracing? An op-ed in the British Medical Journal, and it's basically saying the reasons why it was stopped against WHO recommendations have not been published. And that's been the situation all along. The United Kingdom government is going on unpublished recommendations based on unpublished information or unpublished reasoning by a group of theoretical modelers who have published papers. The paper I saw has no citations. It only has a list of references at the end, so you can't tell what bit of the paper came from what reference. And it uses almost no, it doesn't seem to actually, although it cites the joint China WHO report, it doesn't use any of the conclusions from that report. It just doesn't seem to use the conclusions about, for instance, it's not airborne. Then they don't use that conclusion. But the conclusion that 75 to 85% of the spread is in households in China, they don't use that conclusion. They assume a third of the spread is in households. That there's almost no asymptomatic spread. They don't use that either. And they don't even discuss this. They simply ignore it. And these are the people, and I don't think that there's any policy behind this. I don't think there's any politics behind this. I think it's just that they are headspace modelers who are just not looking very closely at the experimental data, because it's just not the sort of thing that they pay a lot of attention to. The nitty-gritty details of ongoing experimental investigations that have not yet been totally you've got to the stage of the reviews, a year later, and they're just not paying much attention to it. So anyway, so what is the contact tracing? So these things that I just explained, they're very important. That it's not airborne, it's not happening in the community. So the results of all this, it is very different from SARS even. So the SARS data, and these people aren't even using the SARS data. because the SARS data, for instance, and SARS was infectious for 3 weeks. But they are saying you only need to isolate for 1 week. So they're not even paying attention to all the research on SARS a decade ago. Because surely it makes more sense to use the infectious period for SARS than the infectious period for flu. They're just not paying any attention to this data. And then the viral shedding data for COVID-19 is that you're viral shedding until death, or if you recover, until 2 weeks after recovery. And again, they don't even mention that. And so now so how does contact tracing make such a big difference, all these things, and not being airborne? The effect of all this, especially like the 75 to 85% of the contact in China happened through households, and this thing is infectious for a very long period of time. So the combination of those two things means that if you find someone's infected, then your top priority is to isolate them from their own household, because the chances are that they haven't actually infected their household yet, or they've only infected one of them. So you've got to isolate the household from each other, and then from the house, quarantine the household, isolate the person who's infected away from them, so they can't be infected. And so 3/4 of the people of the transmission chains you're trying to stop are likely to be just in the same household as the person who's infected. And then of the other quarter, then most of those will be close contacts, people you have very close contact with, and if you look, for instance, at some of the infections, then one example is there's the first case actually known in Italy, and that's through a clinic and through other patients and doctors. So this is very important for COVID-19, far more than for flu. You have to stop infections in hospitals, because that's got the prolonged and close contact that lets it go from one person to another. Then, so another outside the household, there was an example in Singapore where a shopkeeper was rubbing medicinal oils onto the arms of the tourists who had COVID-19 and got it that way. So that kind of close contact. And then there's look at other examples. There's a prison in Iran, very close, crowded quarters. There's of course the famous cruise ships, where you have close contact with other people. So it's not going through the air system, it's not through breathing, it's because they are spending weeks on end seeing the same people over and over, and you get COVID-19 much more easily in that situation where you've got long, prolonged, close contact between people. Mm-hmm. So it wasn't just spreading through the air like SARS did, but through close contact of people with people. So that remaining quarter or so, I mean, these proportions would necessarily be different. That was in China, there was 3/4 to or more was in the household. These proportions could be different in other countries. But the ones that you're missing are also ones you can find very easily. And sometimes it's a church, of course, famously, but then you have people organise a church, they know all the congregation that come. So there's a choir singing together, then they've got the organisers at least know everyone in the choir, and most people in the choir know each other, and the ones who have infected each other are probably ones who talk to each other during the choir sessions. Sort of the ones who know each other better. So that is why these contacts can be isolated. You can, and this contact tracing is not need. You don't need to be a health professional to do the contact tracing. To do the contact tracing, anyone, you could do contact tracing. You would ring up the person and say, now who is it that you were in touch with? And then you ring up or over the internet and you find, say, what was their phone number? I'll ring them up and talk to them and advise them. And so in many countries like in Italy, Ireland is doing this properly. Then they're using community organisations to do the contact tracing. And then they use civil servants. So you have lots of civil servants who are repurposed from a different branch of government. And maybe they're filling out records about, maybe they're law clerks or something that fill out records in law cases, and then instead they're doing the contact tracing. You repurpose them. And with so many people out of work, isolating at home from work in the United Kingdom, we may well have 1 million people with the necessary skills. We've just got to be methodical, careful. Clerks and people like that, they would be absolutely ideal to be able to follow it up carefully, follow up everyone, say, what about this and that, and ask them the right questions to find all their contacts. Methodical, careful, steady people. Then anyone like that can do contact tracing and help these people to find all their contacts, bring up their contacts, and then get them isolated. You don't need to be health workers. So then, why does it make such a huge difference? So now I get to this diagram, and my last 5 minutes or so, I'll explain this, and then I'll see if I can need to any more. So in this diagram, these are the days, and this is the index case of this cluster. And so they were infected on day 1. And then COVID-19, it's infectious from up to several days before. One example, 10 days before, at least, difference between the symptoms and the symptoms of the person who was infected and the one who was infected. An infector can be 10 days in advance, it can be more. So, but it's mostly 2 to 3 days before they develop the symptoms. Then, so this, I'm just imagining, so that's your first chance of infecting someone. So not everyone, only some of them shed virus before they are symptomatic. But I'm imagining this is one of the ones that does. So they infected someone here. Now, at day 8, and that was on day 2, day 8, they then developed the symptoms, the registered symptoms. Then day 8, which is day 5 into their symptoms, then they start feeling, I really feel pretty bad, and I've got a cough developing, I've got a fever. The fever might develop sometime around there, and the cough is coming, and they think, I maybe got COVID-19, maybe about day 4 or something, and then they go in contact. So up there they were just feeling very low and tired and lethargic, and just this slight coming on in the temperature they didn't notice. It gradually creeps on. It's a very sneaky disease, this one. And then it gets tested at this point because they contact the doctor. This is a place where you're doing testing mild cases, and it gets confirmed. At this point, contact tracing comes in. So your law clerk then rings them up and says, I hear you've just been tested. So can you remember who you've been in contact with? And they say, I'm in contact with my partner. So say, yes, well, you could isolate from them. And then they'll say, and I saw my next door neighbour, we went out for tea. Yes, I imagine it's an old lady, and went out for tea, or we went to the pub or whatever a week ago, and we had a good chat and a natter, and we were talking about this and that. And they say, right, they're another contact. And then they would ring up this person, say, this person's got to isolate, and tell them to isolate until 14 days from the time when they contacted this person. So this was day 2. They have to isolate to day 16. And this person would have to isolate for 14 days. And so quarantine is the word. They quarantine, they're not isolated, they're not known to be infectious. But the more rigorous you do it, the more you actually say, you might be infectious. So this isolated person, this quarantined person, is quarantined from everyone. And at this point, they go through their pre-infectious stage. But this is the point at which the actual quarantine steps in, these pink lines. And so you imagine they could have infected someone then, but it just so happens in the alternative future where they weren't isolated, then this lady had tea with, then she's got a friend that she has tea with then, and or a meal together, or they go and it's a knitting circle or something, or whatever it is that they do. And that was going to happen then. May even have been 3 or 4 of them that are saved from COVID-19 because they managed to do the isolation before the event happened that would have led to the infection. And then this is another one. This was isolated before they were even infectious. And that could easily happen because it could be up to 14 days before they start developing the symptoms. So in this way, in this example, they've stopped those 2 cases, and it might be this was a super spreader, in which case they might have had 8, 9, 10 cases that they were stopped because they just didn't happen early on. And if in an alternative future, they would have gone off to like a choir or something and sung away heartily and talked close up to all the choir people, and they'd have all got it, and that was stopped. So this is very, very effective. So I hope you can understand a bit better why contact tracing works and why it is so important. And our government not doing contact tracing and not even isolating these people, then that is why. And then so we've got this article from British Medical Journal. Case finding, contact tracing and testing and strict quarantine are the classic tools in public health to control infectious diseases. WHO say they have been painstakingly adopted in China with a high percentage of identified close contacts completing medical observation. So that's what I just talked about. All these people that were identified, and these people would have been identified. In Singapore, Vietnam and South Korea, meticulous contact tracing combined with clinical observation plus testing were vital in containing the disease. This combined with strong measures to enforce isolation for travellers returning from high incident areas obviated the need for national lockdown and closure of all schools in Taiwan and Singapore. The mathematical model used by the UK government clearly shows that rigorous contact tracing and case finding is effective. The prediction of 250,000 deaths was predicated on what would happen without contact tracing. So a bit more about this model. The paper about this model doesn't have any citation, it's just got a list of references at the end. Did I actually say that already? The model just doesn't even have, it doesn't actually take account of these things. I think I said that already. Yes, the model doesn't take account of these things, of the basic ideas behind it, and it just doesn't have the possibility of putting in contact tracing. It not only doesn't have it, it was predicated on not having it. It doesn't even have it in it. There's no way of doing it. The model also doesn't model what's happening in hospitals. So that 250,000 deaths is not actually that accurate. It could even be more than that. And so this clearly shows that rigorous contact tracing and case finding is effective. I think at 250,000 deaths is based on the 50%. I don't know. I can't remember now. But it's tens of thousands of people are going to die. Even then, they try and flatten the curve. Anyway, as they say, the reason why tracing was stopped against WHO recommendations have not been published seems connected to a shift from contain to delay in the government's action plan when contact tracing was replaced rather than supplemented with other control measures. And when I looked at the contain and the delay phase before it happened, I was telling everyone there's no way that they're going to stop the contain. I thought they were one after the other adding on. But when they moved to the delay phase, they abandoned the contain phase. That was the very controversial thing. The delay phase was fine on its own, but it should have been added onto the contain phase. And it wasn't clear to other people looking at it before the government acted that they were going to drop the contain, which is what they did. And there's no reason has been given for this. They haven't explained. This is all being done via the people just talking behind closed doors and presenting their reasoning to the government. And it's not being presented to scrutiny by the general public, by other modelers, by experimentalists. This should be happening in the public. It's such an important decision, and it departs completely from the WHO recommendations, and this should not be done by a group of modelers who are privately advising the government without any public discussion of the basis for their decisions. And that is very serious. in my view. And so I'm asking you, please. I am not very. I only get a few thousand people. I only get a few thousand views on my Science 2.0 blog, and maybe 10,000, 15,000 for the most popular. Very occasionally I get 100,000 views on something very popular. I haven't managed to get that for any of my COVID-19 articles. And then I only have 300 or so people following my YouTube channel, and only maybe 50 or so are going to be watching this. And so you feel, compared with the outreach of the BBC, say, and the millions of people that watch them, what can you do? And I haven't been able to do much. I don't feel I've been able to do much. So ever since the very day that they said they were going to delay phase on the 11th of March, then I immediately wrote my articles, I did videos, I tried to get a petition to the UK government, which was after 7 days, it was rejected for reasons that are rather obscure. I then did 2 more petitions, I divided into 2. The first of those has been rejected. The claim was it was similar to another petition, which it wasn't the same as. So the people looked at it, only a cursory understanding of it, if they thought it was the same as this other one. I've got another one that has been held in review, and it's still being held in review, getting on for 2 weeks later. It should be finished in 7 days. So we're not managing to petition the government. I'm just trying to email, contact the leaders of all the main parties, the health secretary, the shadow health secretary, the doctors. I've been contacting everyone I can that I can think of, but they're obviously swamped with COVID-19 emails themselves. I've just not heard back from anyone. And so I think the most effective way is just talking to people on social media and share it. And if any of you are good at graphics and you can make something viral, I mean, I'm very, this isn't hardly going to be a snappy graphic that's going to, it's the best I can do, but it's not a snappy graphic that's going to be shared and go viral. And if any of you are good at making snappy graphics or text messages or any way of just kind of trying and get more attention and just talking to people, trying to raise awareness, and we are getting things happening. The article in the British Medical Journal, we had people saying very strong words about the government right from the beginning, and we've had a few people, but they're not much reported. So please, I'm doing my best to be as positive as I can in what is a very difficult situation. Personally, absolutely, you've got to protect yourself. So that's what I'm just going to end with. Now I'm going to stop, because my videos tend to get too long, but I'm just not very good at snappy short videos. I can try them occasionally, but so what you've absolutely got to do, just reminded you over and over again, you've got to protect yourself. If you're in the United Kingdom especially, then remember this virus can only get to you through your eyes, nose and mouth. It's not a contact virus. It can't get through your skin. It can't get through the air by breathing. It can only get through you by the big droplets that people produce when they cough, sneeze or talk. And they can either, you've got to be very close to them so they come directly into you, or you've got to be touching something that their droplets ended up on. Like for instance that lady in South Korea who was rubbing medicinal oils onto the arms of people that probably coughed onto their arms. And so it got into their hand, and then eventually later their hand touched their eyes, nose and mouth. So even then she would have been safe if she had rigorously washed her hands before touching her eyes, nose and mouth. Then she wouldn't have got it. Even if you're doing something risky like rubbing medicinal oils onto the arms of someone who's got COVID-19, and then you wash your hands before you touch your eyes, nose and mouth, you are not going to get it. So be very careful about doing the washing your hands, and not touching your eyes, nose and mouth except with your hands washed, and keeping a distance from people. If you do that very rigorously, and not touching your eyes except with clean hands, wash your hands very thoroughly, following Dr. Tedros' advice about how to do it, all the things he does, step after step, and there's no way for it to get into you. And make sure everyone you know does that. And in this way, you're not just protecting yourself, you're also protecting everyone. You're saving lives of people you don't know who could have got it from you getting it and passing it on to someone else. So it's very important in the United Kingdom to do that. And then the other big recommendation I make in the United Kingdom is postpone hospital appointments. If there's anything that you have that is not essential, then we are being asked to postpone it anyway. Do that. Don't try and get your appointment. Even if you've been waiting for it for years, this is not a good time for it, because so long as it's something that's not life-threatening, not important in that sense, then the people, the hospitals need as much space as they can to treat the people there, and then as well as that, then the hospitals certainly, I would say with absolute 100% certainty, there are what they call nosocomial or something, infections going on in hospitals. Every time there's been this number of people infected, then you get people infected in hospitals. There's 70 doctors, and you've got these doctors and nurses dying. Doctors and nurses dying of COVID-19 means that there's COVID-19 in hospitals. And they almost certainly. And then absolute certainty, when you look, I don't see how it could be less than about 100% certain that there is COVID-19 endemic in several hospitals. There must be by now. So if you're going into a hospital, then you're risking getting it. And so again, when talking to other people, pressurise. Our government, as its top priority, needs to not test the NHS workers at home to see if they've got flu and then they can return to work, which is what they're doing right now. They need to test NHS workers in the hospitals and the patients. And there's some pressure on them to do that. I think I heard someone saying they need to do that. They should have done that weeks ago. They should have been doing that all along. That is absolute top priority. There's no way that we're going to be able to contain this without first eradicating it from our hospitals and separating the hospitals up so that some are for COVID-19 and some are for people who don't have it. And the ones that don't have it are being treated by healthcare workers that also don't have it. And we have to do that. So that's my other top priority. And so, but as a personal advice, then that's what I would say to do. And if you're in the United Kingdom, but if you absolutely have to go to hospital for something, say you're pregnant, you can't postpone going to hospital when your baby's being born, then, and it's a particular thing for pregnant women, then babies are not at risk from COVID-19, very, very low. There haven't been any examples of babies dying of COVID-19. There's one example of an infant in the United States, which is probably not necessarily that he was dying of this. The under 1 year old newborns, they seem to be immune to this. They very rarely get anything at all. If you're infected as a woman and you're just about to have a baby, your baby doesn't get it. It's different from some of the other diseases. It doesn't transfer to your fetus. And so if you due a baby during the COVID-19 outbreak, don't worry that your baby's going to get it. Even if they get it, they're very safe from it. And if you're a young woman, then your risk of actually dying of COVID-19 is actually quite low, 1 in 1,000, and a higher risk of maybe 2% that you would need to be on the ventilator. And there have been cases of babies being born to women who are on the ventilator, and that was successful. And the baby didn't have COVID-19. And so, absolutely, if that's, and don't hesitate if it's something important like that. And, that you absolutely need to, because you're just about to have a baby born, then, you need the best medical care. But if you can, and, most hospitals probably, certainly, depending where you are, in London it's a higher risk that your hospital has it. If you're in one of the outlying, if you're in Scotland, then there's a reduced risk, for instance, because we have fewer cases, and some of the other outlying areas have reduced levels of this. Not gone, not none. We have them even in Argyll and Bute, the islands where I am. There are cases in this area, but there's much less than there at the moment than there are in London, say. So, anyway, that's it. And so I'll stop here. And so hopefully this helped some of you who are scared. I've tried to be as positive as I can. It's mainly for my UK listeners. And the really big positive message about all this is that we can definitely suppress this. Absolutely certain. We just have to do the contact tracing. We just have to do this. We just have to do the testing the mild cases and the contact tracing. Do this rigorously, and we've got 1 million people at home, and then the isolating is going to be a big challenge. If we've got 1 million infected, it's going to be a big challenge to isolate 1 million people. But one more thing to say, so I'll just say that as well. The WHO say it's very important to have an all of government, all of society approach. So and it's very important sort of, if you're out in the community, even though you don't need to do the physical distancing, actually, because it's not airborne, unless you're talking to someone, or they're coughing and sneezing. Apart from that, if you just walk past someone in the street, you're not going to get it by breathing the same air. But you get these people who sort of going shopping and in the shop, one of the shopkeepers sort of edging away from you because you're a bit close. They don't actually need to do that unless they're talking to you. But because that's what our government is requesting, then it's good to go along with that, because it's got to be an all of government, all of society thing. We've got to be all of it together. So work with the other people, even if they're doing things that are not actually needed, but they're not actually harmful. And then the way to solve this is that the government has to come around and they have to realise what's needed, find their way towards doing the testing and the isolating and quarantining. They have to then inform the public, and the general public have to understand and be in it along with the government. So effective communication from the government to the people, which they have been doing reasonably effectively for this lockdown. They've just not been giving us the right instructions. And so one problem is, can they retain the confidence of the people while changing the instructions and saying, oh, we should now isolate until you feel better plus 14 days. We now need to test everyone. We now need to do all this contact tracing. So they're going to have to transition to doing that, at the same time retain the confidence of the people. And maybe a big apology or something. I don't know how they're going to do it. They're going to have to do that. And then with confidence of the people, then we have to find a way to isolate hundreds of thousands of people at least. And that's going to be quite a challenge. The Chinese did it with much fewer numbers in Wuhan by having vast stadiums full of beds, and with the community centres, with so many that we have, more than they had in Wuhan, and need to be isolated, then maybe a lot of them have to try and isolate at home, but with much better advice on how to do it. And maybe that's the best we can do until the numbers have gone down a bit. And in the contact tracing, now there's one more way to do this, which is to test, you don't need any contact tracing. You can really ramp up the diagnostic tests, test absolutely everyone, symptomatic or asymptomatic, all 66, 67 million or whatever it is. If everyone gets tested, then you find these people who are pre-symptomatic, and if you go all the way through the society doing that, do that on one particular day, then do that as often as you can, then that is another way of radically reducing the number of cases without the contact tracing. That's kind of the high technology way of doing it. If you're a wealthy country and you've got high technology and you can really ramp up to millions of tests a day. But the contact tracing is the low technology way of doing it, is very effective. Right, so I'll stop. And I think I've said everything. Just to remind you, this is very, very effective. And we can go from, if we've got say 100,000, we could go down to 10,000, then 1,000, and then to 100, 10, 1. And it's all gone. And it could be gone sometime in June, if we do this. And then it'll be over. And then you can have your summer without COVID-19. It's not impossible. We're already seeing Italy and Spain getting it under control. So, anyway, I hope that helps some of you.